Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Hello, I'm Angelo Ratini, D.O., and I'm here for the POMA Does podcast program with Beth DuPree, MD, and Ann Shivas, D.O.
Thanks, Angelo. I think I owe a big thank you to our team at Redeemer that invited us to one of the POMA dinners, which was fabulous. It was the night before I was leaving for Milan, and we were in the Milan room, which let me know that I was exactly where I was supposed to be at the right time. I am a board-certified surgeon in general surgery, specializing in diseases of the breast after my first 13 years of general surgery, which not only did I do breast cancer surgery on your patients, Angela, I'm probably sure I did gallbladders and hernias and appendectomies at the beginning because I did do all of that. My practice in breast cancer then expanded and I got board certified in integrative medicine, which was much more in alignment with my osteopathic colleagues who were already, to me, ahead of the game, looking at how you treat whole patients. Fast forward, I got certified in psychedelic therapy and got interested in the world of bioelectric medicine when I got introduced to transcranial electrical stimulation and then non-invasive vagus nerve stimulation and then Ion Cyclotron Resonance, which is how I got to meet and know Ann. Ann is an amazing practitioner. She is a Canadian osteopath, which I'm going to let her explain the difference. And she and her partner, Dr. Alberto Garoli, came to the USA in January and introduced myself, Dr. Kreischer, and my partner, Dr. Anna Mazer, to a phenomenal technology called Ion Cyclotron Resonance. And thanks for hopping on from Italy late in the afternoon, but we're excited to be here and really grateful to POMA for inviting us to talk about this technology.
Yeah, super excited to be here. And we've had some surgeons, actually, I think some students from POMA even learn about ICR. So we can talk about that a little bit later on. But I'm an osteopath registered in Quebec, and I had the luxury of actually working with Cirque du Soleil athletes. And that took me down the path of saying, okay, with these athletes that need a better recovery, how do we do this? How do we work with them? How do we keep them going? So the great and maybe not so great thing is that you get to see a lot of injuries and then take these athletes on their journey. So that was the start of my career. And then I got into doing a lot of post-surgery or post-operations or pain management and these kind of things. And my practice was more around the people who were exiting the system. So they'd maybe gone through a procedure and they needed some more support on the other side. They were maybe a little bit lost in the system, weren't sure where to go, didn't have much success. And that's where I was stepping in. And so as Dr. Beth had mentioned, my beautiful partner, Dr. Alberto Garoli, had introduced me to ICR, and I integrated it into the clinic in Canada and had a lot of success and was gathering data and doing case studies and just seeing, a bunch of things that I had never seen before that I could actually start to treat and work with to help people through their pains and help people through even mental health and these kind of things where people maybe don't really know where to go. Fast forward, I met Beth at a conference that I was speaking at in Tucson, and she gave me one of her books, which, by the way, read it. If you haven't read it, you should read it. 2 books, sorry, now. There's 2 books out. Yeah, we really took into account that we could start to bring this wellness device into the USA. And so Beth's been a pioneer in helping us bring it into the USA and introducing it to practitioners.
Angela, one of the things that's amazing is as I have progressed through my career, so many of my colleagues that are doctors of osteopathy are not using OMT in their clinical practices at all. Their training shifted completely more into allopathic medicine. And the gift that I was given by meeting Ann was to watch how she's utilizing her techniques and her gifts as a manipulative osteopath in concert with his ICR technology. And I see a place moving forward where this ICR technology can potentially be intertwined with OMT because we basically give the body a framework from which to come into alignment again, which is the way I look at osteopathy, is bringing everything back into alignment. So, Ann, you might want to explain a little bit more about how that works, but I've learned so much from you. I think that your diagnostic skills, the skills that you use when you actually look at someone and your background in embryology and what you studied for your PhD, because that aspect of the physical body, we don't get taught this anymore, Angelo. I'm kind of bummed out because I feel like we've taken 10 steps forward, but we forgot the basic building blocks that our bodies are embryologic wonders, and we don't use the information that our bodies give us to help our patients heal.
Yeah, I mean, you guys do great work, and there's people that do need the knee replacement, right? They do need it. And so we still need to keep that line going. But what about the people that are falling through the cracks that can only maybe tolerate so many injections? That was my question. Where do they go after that? And so I thought, gosh, I'd love to fill that gap and help people through their journeys. And a lot of it was based on embryology. What body do you live in? And what body is walking through the door today? And my intakes do take a little bit longer, that's for sure. And I'm asking a lot of questions. And then I'm seeing what they're expressing in that moment based on their environment. And so this plays a big component in, one, what frequency we choose for them when they are laying on the mat. And two, we can actually do the manual manipulations on the mat, which is the ICR mat. I can explain a little bit more, while they're getting a frequency pumped into the body. So for example, if someone's really, really nervous and you're not even able to move a part of the body because they're just so stiff and they're so nervous, maybe they've been through, let's just say, a car accident and they aren't able to calm down and the nervous system can't calm down, we can actually facilitate the calmness through the ICR technology and then help the body regenerate and align back to the space it's supposed to be. This was all known by Dr. Andrew Still, who's American and actually came up with the origins of osteopathy way, way back in the day. And he talks about it. He talks about the alignment of the body, the mind, and the spirit. And so I started with the body, the embryology part. I went into the mind, and then right now I'm really delving into the spiritual and soul component of the body. And this is what he talks about. He talked about it way back in the day. So it's already embedded in the USA. I don't know if it got lost. I'm not sure. I'm not sure where it went. But I think this part can be brought back alive and help facilitated in clinics to just guide people down a path that might be really good for them and beneficial for them.
I want to know where your brain is right now, Angela, because you're going like, wait a minute, DuPree is a breast cancer surgeon. I know she operates on cancer. What is going on?
It's new, so not a lot of people are going to know really what it even stands for, let alone what it involves, what it entails, how do you do it.
When I met Ann, she reached out to me after she read my first book, The Healing Consciousness, A Doctor's Journey to Healing. She said, I want to introduce you to technology. In Italy, ICR is a medical device. It is a medical device. So they have a lot of literature on it. And one of the things that I had been guided to know is that I was going to be introduced to a frequency technology that can regenerate tissue, which some people go, well, that's BS. Like, how do you regenerate tissue? Now you're talking about body parts. When Ann shared with me a clinical case study, which we'll give you the link to the paper in this podcast, it was a case study on a person that had avascular necrosis. And you know, AVN is a congenital issue where you lose the blood supply to your femoral head. And using ICR, using the right positive molecules, vitamin D3, K2, calcium, magnesium, everything, over the course of, I believe it was 12 weeks, they were able to show on the MRI that femoral head came back to its original state. Now, I looked at this and I was like, oh my God. First of all, I thought, okay, if we bring this to the US and you stop having to do joint replacements for orthopedic surgery, I'm going to end up in the crosshairs of some company's secret agent or whatever. I was like, you know what? I got to pay attention because for me, Dr. Kreischer, Dr. Mazur, and myself, we all prescribe medications for our breast cancer patients that can diminish bone density. And so my thought in my little pea brain here of the surgeon was, if this can regenerate a femoral head, maybe we can help our patients to not lose bone and actually build their bone back, because you know as well as I do that a lot of the pharmacologic agents that we use for osteoporosis, their studies look good on their tests, but they're building brittle bones. They have atypical fractures. So that was my pea brain surgeon going, all right, you got my attention. I'm interested. And so that clinical study in and of itself, barring anything else, maybe pay attention. And I'm going to hand it over to Ann now so she could explain exactly how it works, because that is a problem that we see in so many of our women as they age because of so many factors. And more women are suffering from complications of fractures and issues with their spine that are ever going to have breast cancer. So go ahead, Ann.
It's amazing, some of the results, and maybe, I don't know, Beth, if you're willing to share it later on about some of the results that we are having with some of your patients, which has been fantastic. It is a wellness device in the US. This is what we definitely need to get across the line, and we have well-being cards. But what these well-being cards do is they actually tell your body a story. So you plug the card into a mat, and that's patients have actually nicknamed it the magic carpet. So they go for a magic carpet ride. They lay down on the mat. They have to be hydrated because Ion Cyclotron Resonance, we're actually moving ions in the body that we're resonating with. And so anything plus on the periodic table, we can move and we speak to it. So we plug into a card and it starts to speak to the body through wave forms. And there's about 30 different waveforms that we use to move molecules in and out of the cellular membrane. And so this is really great because imagine you're waking up with muscle cramps in the middle of the night and maybe you're lacking magnesium. Everyone's been there, right? And I am right now. It's 36 degrees Celsius. I don't know what that is. It's over 100 degrees Fahrenheit in Italy at the moment. So I'm sweating and I need the minerals, right? But if it's not going into my system because I'm stressed, for example, I might get a muscle cramp. So I can take the magnesium orally and I can lay on the mat and I'm able to deliver it into a certain place, maybe my calf muscle, okay, and say, you need to deliver magnesium there. And then voila, your cramps are gone, which is wonderful. But we can do this for many things. And this is what we've been doing with us patients in the clinic. And at first, I have to admit, when I first got my device, this was many years ago, I thought, oh, there's no way. There's just no way that I'm going to help this person get out of their pain that they've had for 10 years, right? And I'm thinking, okay, I'm just going to explain to them that it's going to be a management tool. And then all of a sudden, they actually don't need the tool anymore because we've actually modified the system to heal itself and live differently in the body. And I thought, okay, now we're putting people in the proper healing state where we really want them to be. So that's where my light bulbs went on. I said, I need to start collecting data on this. And by the way, we do have many more studies we can share with you guys so people can look through the modalities that we are able to work with, which is quite vast. So Beth, do you remember when we were in Italy and we talked to Valerio?
Valerio was a financial guy. He was helping one of his clients who was really suffering with the end stages of cancer. And they went to look at a device that uses a very narrow frequency, but he was able to receive some relief of his symptoms. But this kind of set Valerio's brain, who he's really an engineer, set his brain off on this path that instead of just looking at this narrow frequency, he is a musician. If you ever get to Italy, I got to send you to Trento because these guys jam and they've got goats walking through the room as they're playing. Like it's the most beautiful thing you could ever see. But the way he explained it to me was the initial technology that his friend was on was like one instrument playing one note the whole time. But what he saw in his mind's eye was if you play the same note with a clarinet, a tuba, a French horn, a piano, and a flute, you play the same note, our brains can hear which instrument's playing that note because there's a difference to the resonance of that instrument that allows you to separate it out. And that's where the previous devices were using a single type of like a sawtooth waveform. And what he did was he took square waveforms, sinusoidal waveforms, like he used multiple waveforms, which is really like the cacophony of his orchestra, and looked at the frequencies that resonated with different molecules in the body. And what Ann's talking about, these cards, they look like credit cards. They've got little chips in them. And so each of these different cards has a different resonant frequency, which when you plug it into the mat, delivers that frequency of that orchestra at that time frame to deliver that to the body. So basically said to me, this isn't just a plug and play, like the Mind Vibe, the vagus stimulation technology that we have, which is amazing. It's a plug and play technology. You put the patient on it, it delivers a frequency that stimulates the vagus nerve. And it is amazing for that. But it's a singular device that has one function. The ICR is multifactorial, multifunction. And what we have been able to see, and I will tell you the first patient, and I say God put her in my path. It was an old nurse, an ICU nurse that I had from St. Mary. So I've known her forever, right? She came to me for a breast issue. And when I walked into the room, she said, DuPree, do not touch me. I know you're a hugger. I have CRPS, chronic regional pain syndrome. Do not touch me. And I'm like, well, okay then. So we did the whole breast thing, talked about all this stuff. I didn't hug her. And Ann and Alberto had just come to the office that day. We were doing our course that weekend to learn about ICR. And I walked down the hall and I said, all right, a little brain trust here. You guys say you've got this technology that's so good. I got a lady who's been on narcotics and anxiolytics for close to 10 years. Can I bring her down the hallway? Had I not known her so well, had I not known her as a nurse, had I not been her mother's breast cancer surgeon 20 years ago, I wouldn't have said, hey, listen, do you want to be a guinea pig? Anyway, I went down the hall. She said, I'll try anything. So she walks down the hall with her cane, very slow, with her sister, came into the room. I handed her over to Ann and Alberto to get up on the mat, walked away. Probably 30 minutes later, I came back, and there in the room is Dr. Garoli with a piece of paper. Now, mind you, you cannot touch her doing this on her arm. And I'm going, holy mother of God. And she said, I don't feel pain there. Angelo, with God as my witness, she hops off the mat. She hugs me and said, I haven't been able to hug for years. I got a letter back from her pulmonologist, who you know, who I won't mention, but he's like mentioning this treatment and blah, 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 blah. Her neurologist called me and said, I got to know about this because I have never seen anything like this. And to this day, like, she's incredibly grateful because she's now dancing at her parties. We've given her an aspect of her life back, decreased her pain medications. I just wanted to be able to get her through surgery because I had to take her to surgery. So I thought, if I can use this technology to help with postoperative pain management, with getting her to and from the OR, she was a divine gift that day because she blew everything I ever knew about this stuff out of the water. And I am very grateful to her. That was my, like, okay, pay attention because I think this stuff works.
Yeah, I had a pretty big one in Canada. As you guys know, it's not warm. And I see a lot of osteoarthritis, a lot, because where I live is moist, a moist environment, and it's cold. And so people just have a really rough time managing that in the winter. And we were having people able to actually walk again when they can't walk, especially in the wintertime, because they get flare-ups. And so these are the kind of stories that we have. And I think it's worth letting people know this isn't like a muscle stimulation. It's micro Teslas. So the level of frequency is so low that a lot of people lay on the mat and they say, is this thing even on? So we have something that's called a field detector that we put on, and you can actually see, you know, when the waveform's coming through. So it sounds a little bit like Morse code, dit, 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 or wee, depending on what frequency is coming through. You can hear it, but a lot of people will lay on the mat and they won't necessarily even feel it. They may feel a little bit of tinglies. So that's something quite interesting, but it's also very safe. Okay, so someone's not going to overdo it. And so the bioelectrical part is the part that we plug into the wall because it has electricity. But the field coming through, we call biomagnetic field. So it makes a field all the way around the body that we're treating when they're laying down on the mat. And we can measure that. There's apps that you can even measure what waveform is coming out of the mat in that moment. So you can see what waveform you're getting treated with. And some people like that because they're like, well, you know, is it on? What's it doing? I want to study a waveform, and so on. Now, the interesting part is it's not one waveform coming through a programmed card. It'll change every minute. Okay, so in 1 minute time, you might have a certain messenger system coming through that I always say it's like telling your body a story. It's opening up. It might calm the body down before we're about to do the delivery, for example. So there might be a calming aspect, and then the story opens a little bit more and says, well, now we need to deliver some calcium into the bones. And then it goes through that process. Now we want to maybe lower some inflammation a little bit and work on homeostasis and get the body a little bit more calm. And so as you can see, there's this whole story that we're telling the body just in one card that usually is about 36 to 45 minutes long. And for the people who are really quite chronic, we would maybe do like a 72-minute treatment approximately. And over time, they'll start to feel different because they're actually having the delivery system that they need to get their body back to homeostasis. And naturally, that's where everyone wants to be. So that was the glorious part that I noticed. I was like, okay, people aren't feeling like they're getting electrocuted on this thing. And it's very low intensity, which is wonderful.
So what I want to preface all of this with is I read this book, Bioelectric, a few years ago. It was recommended by Dr. Jack Cruz, a neurosurgeon who I follow on social media. When I read this book, The Bioelectric, it's by Robert Becker. He's a orthopedic surgeon who clearly was able to demonstrate that our bodies are bioelectric. The Rockefeller model of medicine is very biochemistry laden. Like, it's all about the drug delivery. And so The Bioelectric was one of the first books I read. The second book I read was Healing is Voltage. And you can see I kind of was nerdy. You know, it's all highlighted. And because of my introduction to transcranial electrical stimulation 15 years ago, I was already very much aware of how our bodies are electrical. If you don't have a heartbeat, you're dead. And if you have an arrhythmia of your heart, your body doesn't function as well. So think about it on a cellular level. And what I know to be true is that we've missed a lot of opportunities for our bodies to heal. And I don't think that the ICR is doing something to the body. It's moving things through the body, moving these positively charged ions into areas where your body can then utilize them for the healing process. And the reason why, if I hadn't read The Bioelectric by Becker, I would have really questioned the avascular necrosis paper. This is where fundamentally we've got to break the paradigm that every disease needs a medicine to be treated. When you talk about functional medicine, which Dr. Kreischer's just finished her fellowship in it, when you talk about functional medicine, we're not just looking at the symptom, we are going back to the root cause. And this is where I believe bioelectric medicine, where plant medicine is actually getting to the root cause and allowing the bodies to heal, which is much more to me, in alignment with osteopathic medicine and homeopathic medicine than it is allopathic medicine. I trained at Hahnemann. I didn't learn crap about homeopathy. I love homeopathy. I use it all the time. I learned more about osteopathic medicine because most of my doctors, most of my partners in crime, as I said, over the years, Dr. Riley, Dr. Scarlett, Dr. Mazel, like all of my inner circle colleagues, vast majority are trained. And I didn't even know that osteopathy existed when I applied to med school. I mean, I knew it existed, but I didn't really know enough about it. I applied to all allopathic schools because that's what I knew.
And the wonderful thing is, Beth, what you've done is great with your patients, and I think we also can say that when people are taking medications, homeopathic supplements, ICR acts like a delivery system. So it's not saying don't necessarily take this if you have to be on it, but we can help it deliver. Or if there's a side effect, we can work with that. So we're not here to say, hey, look, cancel everything else that you're doing. We're here to say we're a teammate, because this can actually add another modality for clinicians to use and say, well, okay, you're having a reaction to this medication. Maybe you can't be on it. What else can we do for you? You've used up your limit of pain medication or shots or whatever they're getting. How else can we help manage that pain? Or maybe they have to stay on the pain medication. So there's other ways we can use this in clinical that's able to actually help people through whatever they're going through in their life. And that was something that I thought was really interesting, because in Canada, I do collaborate with a lot of medical practitioners. And I thought what was interesting is at the end, they would say, well, I don't know what's wrong with you. Just go see Ann. I'm like, okay. And I got to see the people that were falling through the cracks. And I think that was the most wonderful thing, because you see someone when they're almost at their lowest low, they have no energy. Pain just drains energy out of your body. It just drains people. They get in a bad mood and so on. And so I've seen it with some of Beth's patients coming into her clinic with pain. But the one story I did want to tell was when we do an intake with a person, I listen for sets of 3. If they repeat the same thing 3 times, I'm kind of like, okay, I'm going to make sure I mark that down. And there was a woman that came into Beth's clinic, has been a patient of hers for a long time. And she goes, Dr. DuPree sent me. And I said, okay, well, what are you here for? She said, I can't sleep. And I said, okay, well, what are you doing? I'm taking all the sleep meds. They're not working. Nothing's working. Okay. And so I started asking her about her life. Well, I found out she lost her mom earlier on that year. She was a caregiver for her father, and she started tearing up. And so actually in that moment, I said, look, I've done this treatment on 5 other people. I'm going to do it on you. And what we did was actually we lowered her brainwave state with a card called Deep Rest, which is primarily delta waves for the brain. And if you watched her walk in, super overstimulated, can't sleep and so on. So we promoted delta waves in the brain. At the same time, I actually put on a music for her in the clinic, which was alpha waves. And I said, this might bring up some memories of maybe why you're not sleeping or maybe why you're feeling overstimulated. And I said, if you're comfortable, I'll leave you for 30 minutes. And I just checked in on her kind of in between. And she was crying and crying and crying and crying and crying. And she came out of it. She goes, oh my gosh, I'd never processed the grief with my mom. And I was so stressed because I had to just switch into this mode of taking care of my father. And I just never processed it because I was so busy with house and everything that she never processed it. So the non-sleep was creating pain in her body. And you see where I'm going with that? So as we peel back some of the layers of life, because we all go through these experiences in life, the body can actually start to heal itself. And so that was a really interesting process that we took her through to, 1, decrease pain, pain and 2, increased sleep, all due to the fact that the brain was just in such a chronic stress state for, I guess that would have been about 6 months' time. So when we understand that about the patient, we can actually put them back into the space that they can heal themselves, which I think is absolutely wonderful.
Yes, it is. So how many treatments do patients usually require?
It's a really good question because everyone's different. But with chronic things, best patients who've had cancer and then they've maybe gone through surgery, and I'm going by what we're seeing actually in Philadelphia area, we usually have them in for around 10 to 12 treatments.
With our clinical trial that we did with the Mind Vibe, and what's been amazing is the vagus stim technology. We know we see a statistically significant change after 5 treatments that lasts for at least 12 weeks, which is amazing. And what we have identified, and we're just doing the deep dive right now because we're looking at our final data, is the patients that are medicated on SSRIs and anxiolytics. What we measured in this study, Angelo, was heart rate variability, which is the intrabeat variability of the heart, which is a sign of resilience. If you have low HRV, your body can't recover quickly. And we see that a lot in cancer patients. But in the patients who were not medicated but did the treatment, their HRV improved and it stayed there. And they got benefit out to 12 weeks. In a lot of the patients that are medicated with SSRIs and anxiolytics, and a lot of doctors are well-meaning, when their patients are diagnosed with cancer, they come in and they're anxious and they're depressed, and those are all normal emotions. But the Western medical model is, here, take this pill for anxiety. Here, take this pill for depression. They do not work in cancer patients. It's been clinically shown that they work no better than placebo, which is what I learned during my psychedelic training. But where I'm going with this is we have not seen a shift in the HRV in those patients that are medicated. We see an improvement in their fatigue, in their insomnia, in their overall well-being, but it doesn't last as long because those medications are blunting effect. So this is where in those patients, we're using the combination of ICR and the Mind Vibe to help wean them off of those medications to get them back into alignment where they can be healthy, whole, and complete in themselves. And the beauty of this is in our wellness space in Pennsylvania, our technician was medicated for ADHD over the years, and it never worked for her. And she utilized the Mind Vibe technology to get off of those medications. She's finished her college degree in psychology. She's a beautiful soul. And having been there herself, she can actually help our patients to understand that it takes a different amount of time for everybody. Somebody may get it in 5 sessions, somebody may need 15, but the fact that they know that they can get to that point is a beautiful thing. And we are just beginning this journey. I mean, we brought this technology in January. We really didn't start rocking and rolling probably until April, and we're just expanding it in September. But what we found is that within our breast cancer group, we're now seeing these beautiful women's children who were given drugs for ADHD and anxiety that are coming in for treatments. We're seeing people who have stem pain after a knee replacement come in and get relief of pain for the first time in their lives. And just like Ann said, the piece that she was talking about with this individual with unresolved grief, this is the piece of this technology which we're just beginning to unearth, because this is where Valerio has shown me that we don't necessarily need a psychedelic therapy to be able to access those spaces, because you access the theta, the delta, the alpha. When you can do it through the mat and through those frequencies, which are all wellness deliveries, we can potentially help people to reframe those traumas and to let their body get back into a state of healing and homeostasis. So I'm excited about it. I think it's going to be great. The more doctors in the Philadelphia area, the more of your colleagues. I'm happy to do an open house and get all of you guys to come over and give it a roll, because it's something that I see as a transformative addition to every clinical practice. It doesn't replace what you're doing as a clinician for your patients. It's an offering that you can utilize while you're doing other stuff in your office. If you allow patients to come in, I think it's going to become a mainstay of our Western medical model, because it's an enhancement to what we already do, and it could help us to help our patients truly heal.
I love it. And one thing I just want to add on a little tidbit is I'm looking into the delivery of stem cells. So if we can inject stem cells and use ICR to target them in, rather than them maybe getting used by another part of the body that doesn't need it, we can actually target it. Can we get some type of healing that we're looking for? So injections, let's just say in the knee joints, for example, when someone's having pain, or maybe they're on the borderline of having surgery or they don't qualify for a knee replacement, what else can we do to help them if they're stuck in one of those spaces? And so that's where I'm really interested in, is looking at what other alternative things can we provide if that person isn't qualified to fit into a certain category. So it's interesting because over in Italy, they are trying these things and we're collecting more and more data. There is a research article on stem cells, which I can plug in for you guys as well. I think that's worth looking at. And another study I want to plug in is how we're guiding families who have kids with autism. And again, it's not to replace the model that's already there, but it's to help these kids regulate in the evening, to help them actually have better sleep and recovery so the brain actually starts to recover. I'm going to plug that article in too, because I really think it's worth families and parents to read this because it's a really hot topic at the moment as well.
And we have a practitioner in Philadelphia, Kelsey Bates with Be Well Tots, who's amazing, who has integrated this into her practice. She's in Center City, Philadelphia, and out in the suburbs, but her practice is amazing. And it's a wonderful resource for families that have children with special needs, whether it's cerebral palsy, whether it's developmental delay, whether it's autism spectrum disorder, ADD, ADHD. She's really helping these families by utilizing this non-invasive technology to help them. And it's awesome that Ann and Alberto are in Italy, because in Italy, as a medical device, they can do all these clinical studies. In the US,
we will get there.
Do our studies on osteoporosis and osteopenia and wound healing, which we will share with your community as well, Angelo. But I really want to thank you for the opportunity to have us come on and talk about these transformative technologies, because we are being the change we wish to see in the world. That is my Gandhi quote. And either you're part of the solution or you're part of the problem. And I believe that we are moving forward as part of the solution to the Western medical model that has perfected acute care, but has been lacking in chronic disease management.
I think that sums it up very well.
Before we go, I just want to say thank you so much for having me. And it's been fantastic.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.